Dear friends, welcome to my geriatric medicine channel. Today we will know something about urinary incontinence in elderly people. Elderly women sometimes find it difficult to hold the urine. Moreover, they hesitate to report to the doctor. Why is it so? This condition is called urinary incontinence. That is, inability to hold urine or involuntary leakage of urine. Whenever the patient coughs, laughs, etc., and gets up from the sitting position to standing position, there may be some leakage of urine in them. It is more common in women than men. Urinary incontinence is abnormal regardless of age. It is abnormal regardless of age, mobility, mental status, and frailty. Urinary incontinence often causes the affected person to feel embarrassed, isolated, stigmatized, depressed, and regressed. All these mental symptoms do occur in a patient with urinary incontinence. Friends, this is almost so it isolates the people from social gatherings also. What are the common causes of urinary incontinence? Like headache or chest pain. Inconvenience is a symptom that may result from a variety of medical, surgical, and psychiatric conditions. That is part of normal aging is a myth. It should not be considered as this normal aging process. It because of the disorders in the background that urinary incontinence in them occurs. There are several clinical types of urinary incontinence. Stress incontinence. The leakage of urine during exercise, coughing, cough, sneezing, laughing, and other body movements which put pressure on the bladder. Common causes are weakness of laxity of the pelvic floor muscle or urethral sphincter weakness as occur with repeated childbirth in women, injury, and genitourinary surgery in them. This is about the stress incontinence. Then is another type called urge incontinence. The inability to hold urine long enough to reach a toilet is often associated with stroke, dementia, Parkinsonism disease, Alzheimer's disease, and other neurological disorders. Elderly with arthritis may have difficulty in reaching toilet in time and so have incontinence even with normal urine control. Then there is another type called overflow incontinence. The leakage of small amounts of urine from a constantly filled bladder or half-filled bladder also occurs in the presence of an enlarged prostate in male and long-standing diabetes. This is called overflow incontinence. How to manage urinary incontinence then? Pelvic muscle exercise is useful in stress and urge incontinence. This involves repetitive contraction of the pelvic floor muscles and the exercise is called Kegel's exercise. By strengthening the pelvic floor muscles, these exercises help to increase the closing pressure on urethra and support pelvic structure. Drug treatment is often effective. Oxybutynin is available by name Oxyspath, but has side effects such as dry mouth, glaucoma, and urinary retention in them. Surgery can improve or cure incontinence when it is due to structural problem such as enlarged prostate in males. An adjunct to above therapy is evaluation of the physical and social environment, including toilet access, clothing that makes this to reach to remove them easier. Clothing should be should be like that. It should be easily removable. Chairs and or cots that are easy to rise from and accessible call system is also important. In this context, I also tell you something about frequent urination at night. Some elderly people pass urine at night time. Why it is due to? Yes, it is true. The aged people sometimes pass more urine at night compared to daytime. The main reasons are aging kidneys, excess or late intake of fluids, ingestion of coffee or tea in excess, heart failure, drugs like indomethacin, nifedipine, diuretics, etc. may cause more urination at night. Then the alcohol, very important in males, especially in males. Insomnia, that is sleeplessness. Pain due to arthritis. Breathing difficulty like asthma and the drugs consumed for these diseases. Then the depression and enlarged prostate. All these things causes lot of inconvenience and nocturnal urination. Nocturnal means urination at night. So one or two times may be accepted, but if a patient has to get up every hour or 2 hours is really embarrassing. It should be addressed. Dear friends, this is about the urinary frequency at night in elderly people. Go through this, subscribe it, like it, share it among your friends so that they also may get benefited. Thank you very much. Jai Bharat, Jai Karnataka.